In response to an opioid crisis that has killed thousands of Canadians, the University of British Columbia is taking a unique approach to addressing the problem. They've created a new professorship to see if marijuana can play a role in keeping opioid users alive.
And to try and, generate evidence to address the overdose crisis, it's a dream come true.
Research scientist Dr. M.J. Malloy is now UBC's first professor of cannabis science.
I became a scientist to generate evidence to support the health of people who use drugs, to change clinical practice, to change public policy, and this professorship is the means of doing just that.
Malloy is the only cannabis science professor in the world focusing on marijuana's role in helping people with drug addictions.
We have preliminary research suggesting that there might be a benefit for people starting methadone and Suboxone to be paired with cannabis. That will be our first clinical trial. And as I said, we hope to be recruiting the first patients, the first participants early in the new year.
The 10-year professorship is made possible by a $500,000 grant from the BC government, along with the $2.5 million contribution to UBC from Ontario-based cannabis company Canopy Growth.
What we hope to achieve together is to minimize the harm that substance use may cause to Canadian society and to maximize the potential benefits of cannabis as a therapeutic treatment.
In the first 9 months of this year, 1,143 people died of opioid overdoses in BC alone. Vancouver Coastal Health says the number of overdoses appears to have leveled off, but is not declining.
We're starting to monitor people's journeys through the system of mental health and addictions care. We're looking at every step in that treatment journey, tracking where people disengage, and finding out why. And Dr. Malloy's research and clinical trials will delve deeper into the role cannabis can play in keeping people connected to treatment.
In addition to saving the lives of opioid users, Malloy hopes the work he's able to do will change the way people view cannabis.
I've certainly heard, people joking about, stoners and pot and weed, and I hope that those days are sort of receding in the past. Cannabis science is an important new field. We hope it can contribute to human health and well-being.
In Vancouver, Travis Prasad, City News.